Millions of Americans suffer from depression and are treated with antidepressants. When drug therapy doesn't work, what can you do? Dr. David Aversa is a psychiatrist and the founder of the Connecticut Psychiatric and Wellness Center in Woodbridge, and he's here to talk about treatment options. Doctor, thank you for being here.
Thank you, Teresa.
Let's talk a little bit about your background.
Okay.
How'd you get started?
Well, that's a long story.
Well, give us the Reader's Digest version, I guess.
Well, I was a teacher for a few years and fell in love with working with kids with problems. So made me decide to become a child psychiatrist. But to become a child psychiatrist, you have to be an adult psychiatrist as well. So I fell in love with working with adults as well. So now I treat adults and kids.
So you went back to school?
Yes, I did.
Kind of like a second career for you here.
It's a second career, yep.
All right, so you opened up the Connecticut Psychiatric and Wellness Center in 2010, a couple years ago. It's an outpatient facility. Talk about some of the services that you provide.
Well, I'm always interested in different models of care, and so when I was in med school and I got a degree in public health, I started thinking of better ways of delivering mental health, which is a very difficult field to treat for many reasons, and I wanted to create a facility that treats adults and kids and families, because often you have one treatment place for the kid and one place for the parent and no place that has coordinated care. So when I decided to start Connecticut Psychiatric and Wellness Center, it was to design a center that treats adults and kids, all modalities of treatment. So, and we can treat the families too, because often, if one family member's sick, the other ones are too. And so we wanted to be able to provide full service for everybody.
It's kind of like one-stop shopping, I suppose,
yes,
right?
One-stop shopping.
Let's talk a little bit about depression. Tell me some of the symptoms.
So, we have an interesting field because our diagnoses are I won't say that they're hard to deal with sometimes, because there's the general ones of fatigue, problems with sleep, problems with appetite, mood symptoms, but I think most people think that the depressed person is like the one's tearful all the time, crying in bed, and I would say majority of people with depression aren't. A lot of them are irritable, they get angry a lot, or they're really anxious. There is the sad depressed person, but I've seen it. It looks so different, and it really depends on the person who has a disorder, not the disorder itself. And so, and a lot of people don't even realize it. That's what's the problem with depression. It's really insidious. So people just aren't enjoying their lives as much, and they're not as productive at work, and their relationships suffer, and it kind of starts maybe subtly, but then it snowballs. So.
And this can affect anybody? Anybody.
So I've treated kids as young as 4 or 5 with depression to someone in their 90s.
And how many people are affected? I know we gave a statistic 1 in 10.
Yeah, so the statistics change. The lifetime prevalence in the United States alone is anywhere from 16 to 20%. So you can say 1 out of 5 people
in their life. That's a big chunk of the population.
Yeah, it's a big chunk of the population.
What happens if depression isn't treated?
Well, it becomes, it can be progressive, and symptoms can worsen. And like I said, people can have problems with work, they can lose their jobs, they can have problems with relationships. It varies from people who can't function even getting up and brushing their teeth and taking showers to they're just having a hard time functioning in their daily lives.
And what's the is there a typical course of treatment, or does it vary between cases?
Well, it varies between cases. I mean, the first is to go see a doctor if you have any of these symptoms. And then, typically when someone's has a first break of depression, the typical treatment course is, it could be therapy alone, medications alone, or both. Typically both works better, and that's with first course treatment of depression. But so them seeing their doctor regularly.
And there are a couple of non-drug treatments, though.
Yes, there are.
We have some video we're going to take a look at, and you could explain to us what's going on here.
So we're here to talk about transcranial magnetic stimulation for the treatment of depression. This technology has been around for a while, but what it does is use magnetic energy to stimulate parts of the brain that we know are important for depression. This is a way we can get to the areas that we know are affected by depression, and it's just a newer technology, state-of-the-art, it's drug-free, and there's no side effects to worry about.
And how long would you say one treatment would be? Or do you have to go back for many treatments?
Yes, so it's an intensive treatment. So it's 5 days a week, each treatment for about 4 to 6 weeks. Each treatment is about 37 minutes. It's done in an office. There's no anesthesia. There's really no side effects.
Can you feel it? Like, do you feel it?
Oh, people can feel it, yeah.
Oh, okay.
They can feel it. So it's not just, me putting something on their head like in this video here.
Okay.
People can feel the treatment happening, and one of the ways we know that we're stimulating brain tissue directly is when we first set it up, we stimulate the motor cortex, and we make typically their hand move. So I put the right hand up, I put the magnet on the left side of the brain, and I can make their hand move. So in this video is what he's doing now is actually trying to find out how much magnetic energy he needs to treat the patient. And once we know that, then we can move to the area of the brain where we treat depression.
What have the results been?
We've had great results. I mean, we bought this magnet because we wanted to use all modalities of treatment, and we've had amazing responses, better than I actually expected. It's been amazing how people have walked in, not being out of bed, shower, shave, and then 4 or 6 weeks later they're walking out. Some people start working again, and there's no guarantees, but it works really good.
Right. Is this covered by insurance?
Well, that's one of the biggest barriers to treatment now. A lot of companies are pre-approving it, but most of it's out-of-pocket expense. However, that almost everyone gets reimbursed, and in Connecticut, around 80% of the people get anywhere from 70 to 100% of their money back, but most people have to pay out of pocket at first, and we work with them to try to make this affordable as possible.
Very good, doctor. Thank you so much for the information. Let's put this up on the screen for you. The Connecticut Psychiatric and Wellness Center is located in Woodbridge. You can call 203-298-9005 or go to ctpsychwellness.com and find some additional details there. That was really interesting stuff. Thanks for being here.
Thanks, Teresa.
All right, up next, Victorinox Swiss Army gets ready for their big warehouse sale. We'll give you a preview after the break. Don't go anywhere.